All right. Hi, Jesse. So please
Hi.
share with us what kind of symptoms you have when you first initially consulted with us.
I think my biggest symptom was fatigue. Just this overwhelming feeling of tiredness that kind of escalated through the day and just didn't seem right. I knew that wasn't normal.
Okay. And you consulted with other doctors prior to coming to us?
I did. My regular doctor ran some blood tests that she was concerned that I had lupus because some of the blood tests that they look at for that were positive. So she then sent me to a rheumatologist.
Right. But you did have symptoms of joint pain.
I did. I was having hip pain and then the fatigue.
Right.
Yeah.
So they didn't have any answers for you or any solutions, treatment that helped you with your energy?
No, the rheumatologist basically said my symptoms weren't severe enough.
Okay.
That the fatigue and the joint pain, yes, were symptoms of that, but the whole picture that he looks at, everything basically wasn't to the level that he would call lupus.
So they were interested in labeling it with a diagnosis instead of actually fixing your symptom.
Yes.
Because you didn't feel any better.
No, and I didn't really get any answers because I wanted to know what I could eat or not eat or what I could do to make a difference. And he basically said diet has absolutely nothing to do with it.
Wow.
And pretty much told me to just come in once a year for the next several years to see if anything is developed.
To monitor it.
Yeah.
But monitor
so basically
it
that was it.
anything.
Just go on your way and then we'll see if anything, develops.
Right. Obviously that wasn't satisfactory to you.
No.
Okay.
Well, no, because I didn't feel any better walking out the door, and I was actually quite upset. And my mom has rheumatoid arthritis, and so there was a little bit of that concern just with autoimmunity in general.
Now, how did you initially found this?
I think it was actually my mom that saw a video of yours on Facebook and sent it to me.
Okay.
So I just started watching all your videos and testimonials and reading about you, and it sounded perfect. And
made a lot of sense.
I'm very interested in the whole nutritional aspect, and if there's a way of doing something, more naturally, I'm totally all for that. So
right.
So about your practice,
going through our process, what type of improvement have you noticed so far?
Definitely the energy. Way better.
Way better.
Way better.
Like how much better would you say? 0 to 10, 10 being the best energy. Where was it before and what is it now?
I mean, I felt like it was maybe at a 3.
3 out of 10.
Now maybe an 8.
Wow. Okay, so that's a big jump.
Yeah.
Sure. Other symptoms like digestion improve, hip pain improve?
The hip pain has definitely improved. Like almost totally gone.
Okay.
And digestion, I felt like I was having some digestion, just general like bloating or just, I would eat and then just not feel good.
Right.
And I could never quite pinpoint it, so that's way better as well.
And now you know exactly, especially after we've done the test, you know exactly what food is causing problem.
Yeah, so I did all the elimination stuff and then also the test that showed that I was actually reacting to quite a few foods.
Right. So that gives you a clear picture so you know exactly what to do now.
For sure.
Okay, great. So what do you feel like is the biggest difference between what you've tried in the past and what we do here, our approach?
Well, I mean, I got results. I didn't really try anything before because I was just trying to find answers, and there was no answer. It was
so coming from a medical model, basically they just try to label it as some disease, and if you're lucky enough to get qualified to have some disease, then you qualify for a drug.
Exactly.
Which they never even got to.
Right. So apparently my levels of what I was experiencing weren't quite high enough to be labeled as something, which is good, but they just sent me on my way. And
right. There's no answer
nothing
still.
To do.
Right.
Yeah.
So do you feel like overall this program has definitely helped you and you recommend it to other people?
Oh, absolutely.
Great.
Yeah.
All right. Thank you so much, Jesse, for sharing.
You're welcome.